Chlamydia, A to Z. Its causes, symptoms, diagnosis, and treatment. Now, chlamydia is a bacterial sexually transmitted disease. It's caused by Chlamydia trachomatis. Now, what happens with chlamydia is how it spreads. It commonly spreads among men who have sex with men, men who have multiple female sexual partners, women who have multiple male sexual partners, and men who go to massage parlors, who engage with commercial sex workers, who engage in casual relationships very frequently. Chlamydia usually spreads. Chlamydia also spreads via orogenital intercourse and primarily anal intercourse. So that's best avoid. If you're in the habit of regularly having sexual intercourse with unknown people, be very, very careful because there's very high risk of you contracting chlamydia, especially if you have unprotected sex. It's also important to understand that if you're engaging with someone whose previous sexual history you don't know, be wary of chlamydia. Now, chlamydia has a tendency to spread along with gonorrhea, HIV, syphilis, hepatitis B, as well as hepatitis C, and this is called as STD Co-Infection. So, when a patient comes to a typical clinic for STD testing, we have to test the patient for HIV, chlamydia, gonorrhea, hepatitis B C, as well as syphilis because there's a high risk of co-infection. In STD co-infection, when one STD spreads, other STDs also co-infect the patients. Now, the symptoms of chlamydia. Classically, chlamydia will not have any symptoms apart from burning sensation while passing urine, itching there in the penile tip, pus discharge, watery pus discharge coming out from the penis tip. These are the only classical symptoms of chlamydia in men. Among women, however, if left untreated, women can have again vaginal discharge. They can have an itch over there, cuts coming in the vagina, and if left untreated, chlamydia complicates and leads to infertility, ectopic pregnancy, as well as pelvic inflammatory disease. So, in the context that if a male or man or woman, right, they've had previous sexual partners, multiple casual intercourse, and multiple sessions, multiple people, and if they're settling down and then they're going to try for a child, checking for STDs like chlamydia is very, very important. It's highly recommended. What are the tests to do to diagnose chlamydia? How can chlamydia be diagnosed? So, one, clinical symptoms and signs can be used for establishing diagnosis, but what's recommended is you're doing what's called as a chlamydia urine PCR. It's a NAAT test, nucleic acid amplification test. The chlamydia urine PCR is the best test for diagnosing early chlamydia. And what is the treatment for chlamydia? Again, the treatment depends on degree of exposure because some patients respond well with azithromycin, 1 gram, 1 gram loading, 1 gram dose of azithromycin. 74 to 75% of patients, get completely cured of chlamydia. For some of the patients, we give doxycycline 100 mg BD for a period of 14 days. That is morning and evening after food for a 14-day period. For some patients, levofloxacin can also be used for chlamydia treatment. So, chlamydia generally responds well to antibiotic treatment. So, how to safeguard yourself from chlamydia? Again, it's fairly simple. Always use protection. Always use a condom during penetrative sex. Avoid anal intercourse. Avoid orogenital intercourse with unknown people. As much as possible, stay committed in a single relationship. Try to settle down early. Don't constantly swing partners. Don't engage in casual sexual relationships ever. It's very dangerous. High risk of STD co-infection. And that's the only way, a sensible way to prevent chlamydia. And of course, associated infection risk. Remember STD co-infection. There's always high risk of gonorrhea coming along with chlamydia. HIV is transmitting along with chlamydia. That's a point to, kind of bear in mind. So we looked at, how chlamydia spreads, its signs, its symptoms, how to test for chlamydia, how to treat chlamydia. I hope you found this video generally useful. Please do share this with your friends wherever relevant, of course. And please like, subscribe to and drop in your comments. I'll try to reply to videos. See you soon with another video. This is Dr. Shah signing off for now.